The story is told of a psychiatrist who was standing in a bar having a drink when a couple of men came in from the golf course. They went to the barman and they said, "Is there a doctor here?" And they said, "Sure." The psychiatrist standing on the side of the bar. So they went down to him and said, "Are you a doctor?" He said, "Yes." He said, "Well, can you help Sammy?" He said, "Why?" He says, "He's just stuck the golfing umbrella through his foot. And we wouldn't mind, but all that red stuff's gone over the green, and it's Ladies' Captain's Day tomorrow. We've got to clean it all up." So the psychiatrist looked at him and said, "Did you do it on purpose?" He said, "No." He said, "Nothing I can do about it then, is there?" And you see, that's been the problem with trauma. As we as surgeons have become much more sophisticated and gone down much more straightforward specialist lines, and very few are left to look after the generality of the patient. So what happens in trauma? What happens when a traumatized patient comes in that has injuries all over? They may have chest injuries, abdominal injuries, fractures, the lot. Who looks after that? Well, we're all specialists. Go and get the A&E people to look after it. Unfortunately, of course, these people are unsocial. They don't come in at 9 to 5. They come in early hours of the morning. And who's on call? Senior house officers on call. One of the most junior people we've got. Now, a lot of us have been in that position. A lot of us have been on. Do you remember the first time in an A&E department? Of course you felt totally confident, didn't you? You felt that everything was going to be perfectly all right. Or perhaps, like me, maybe you felt just a little bit scared. Just a little bit in wondering, do I know what I'm doing? Is it going to work out properly? What help do I have? And that feeling of doom comes over when someone comes in. And then your best friend is the nurse, isn't that right? The nurse who's been there for 12, 14 years said, "That's all right, I know what's going on." If you're wise enough to listen to what she has to say. This went on until the late 80s in this country. And the proof of that is in the report of the Royal College, which was published in 1988. What they did there was they looked at 1,000 consecutive trauma deaths. And they asked the question, what would happen if these people were to be taken to a main facility and treated by people skilled in looking after trauma? Those 1,000 deaths, approximately 500 made it to hospital before they died. And when they looked at the notes, depending on whether 3 or 4 assessors thought that the patient might have survived, we find that up to 1/3 of patients dying in hospital after trauma were dying, shall we say, unnecessarily. That was probably one of the largest indictments of the medical profession made by the medical profession in a long time. And that was happening in this country. Now, across the Atlantic, this had been found many years ago. In 1976, an orthopedic surgeon, and it had to be somebody like that, was flying his own plane in Nebraska when he crashed on approach. His wife was killed, 3 children badly injured, and he managed to get himself and the children out of the wreckage. They managed to get taken to a nearby hospital. It had big words. It said, "Accident and Emergency Department." But when they tried to get in, the door wouldn't open. So after a lot of persuasion, they managed to get the equivalent of a resident down. And the surgeon was so appalled at the treatment given to himself and his children that he actually had to get up and do it himself. He had to resuscitate his own children. And he said afterwards, "If I can give better support in the field to my children than it can be given in the hospital, then there's something wrong with the system, and the system has to be changed." And changed it was in America. Nebraska took it up through the Lincoln Medical Education Foundation, and then it went up to the American College of Surgeons, and they developed a course called ATLS, Advanced Trauma Life Support. Developed throughout America, throughout South America, and then in 1988, after this report by the Royal College of Surgeons, it was brought into England with the whole objective to increasing the standard of care to traumatized victims.